Okay, so welcome to a plastic surgery essential skills clinic. Today we are covering vessel anastomosis on this microsurgery simulator. You can get it from medsync.ltd.com/medshop with the MedSync micro set. This is a 4-instrument set, but we actually sell the 5-instrument set, and that's the one you want. We'll talk you through the instruments quickly, and then I'll show you how to do some micro suturing. So first things first, you want to identify your instruments. You've got your dilator and your jeweler's forceps. The dilator has a curved body, blunted tip. Jeweler's hasn't got a curved body and slightly pointier tips. The idea is that you can put this inside the vessel lumen. You do not put this inside the vessel lumen. So we've got a video that you can check out on how to dissect out your neurovascular structures on a chicken thigh. It's called chicken dissection. Have a look. You just strip back the adventitia, but this is a simulated model of vessels. I think it's 3, 2, and 1. This is the 3, 2 2s, and then 1 millimeter lumens. Obviously tricky, but you know, that's what you want when you're simulating surgery. A little bit tricky. I'm gonna use an 8/0 nylon suture to show you how I stitch my vessels. Lots of different techniques, but this is just how I do mine. So typically you then first put your clamps on. Your clamps would be about here and here. Once you strip things back and cut them to check that you're happy with the caliber, you release the clamps to check flow, and then put the clamp back on, flush it with some heparin saline. And then, my personal preference is to start with the back wall. But that's just me. And I tend to do mine with a vessel dilator in hand. So I might zoom in a bit more. Let's see if we can really get you in there. Just there. Great. I'm gonna stitch this one. So I'll do it zoomed in and I'll zoom out a little bit. So I tend to start with the back wall. Of course, there's no adventitia on this, so I don't want to grab the whole thing. The key is that you want to roll the instrument in your fingers. So I usually pick up the adventitia. Tend to put my dilator in the lumen. Open the dilator up and stitch in between. And it's okay if things don't go smoothly the first one, but that's okay. But the key is that the vessel dilator is in the lumen. Open, don't catch the front wall, and then go opposite. And now we need to do the opposite side. Ideally, taking the same principles of when we do normal suturing, mounting it straight away. So, I tend to do the back wall first. If you use a double-ended clamp, you don't have to worry so much about that. And then same thing on this side. The key is to follow the curve. Needle thread needs to be on the same side. And pull. So I typically park my needle in something nearby, like a bit of muscle, but I physically will park it. Let me just do that as I would normally. And then I know it's secure. And I just need to find my short end, which is, you want to get some heparin saline. Make sure everything's nice and wet. And the key here is that you don't cross your hands. So this is my left hand, this is my right. When you tie your knots normally, your short end and long end are meant to alternate. So my short end's here, my long end's here. This short end needs to end over here. So I'm gonna wrap the long suture around the instrument that's gonna bring the short end towards it. The other tip I'm gonna do is to turn the needle holder upside down because my thread is down here. So it's easier to grab the suture thread with the tips down than if the tips are up. So 1, 2, grab the tip. If you have an assistant, they can tie for you. They can grab it for you. Tie. And it's finger tight, not full strength. Leave the suture end somewhere where you can get it next. So I didn't just drop it, I found it somewhere. As I said, I don't want my hands to cross, so this next bit's really, really crucial. Bring the suture to the other instrument, and now wrap it around the forceps, because I want it to bring the short end towards it. Now that's not good. Why is that not good? Because I'm going to get caught in a loop. So undo this loop here, bring this suture thread way out of the way here, and go again. So I'm here, wrapping around the forceps, not the needle holder. My hands do not cross. My needle holder's gone out of field, so I want to bring it back into the field so I have more control of my suture, and tie. Leave the short end somewhere where I can grab it again. So just over here is fine, but don't get entangled with the other one. And now wrap it back around the needle holder again, but tips up because it's right there. And grab. I typically leave the first one long, so this length, because if there's gaps either side of it, I let the clamps off, I have something to just turn the vessel around. If you have an assistant, get them to cut your suture for you. Don't leave them too long. If I'm cutting both, the one that I would cut last is this long suture with the needle on it, so that way I can find the needle before I let it all go. And so now we need to work our way around. I'm sitting on this side, so the easiest suture for me to place would be on this side. The harder one will be on that side. So I'm going to place the harder one first, because I want to make sure I've got the most access to do it. So I'm holding this with tension. So where I'm concerned here is that I might catch the wall in front of it, so I'm going to go inside again. I'm going to try and go inside, like so. Turn the forceps this way actually. The dilator, go in between. Angle wise, I haven't got the flexibility to get the right directional bite. I'm going to come out, mount it straight away, and I'm going to do, let's pull up here and do the other side, angling it down. So that suture really is helpful. Didn't take the bite. Let's try that again. So I've let go of it, but I know it's in the wall. I can see it there. And just follow the curve. Don't pull it through, otherwise you'll rip the adventitia. You'll rip the lumen, that's not ideal. And pull it along the vessel length. Park this somewhere where you can see it. this is where it gets a bit tricky because this one gets in the way, but keep it out the way. I want to tie with this one. So orientate yourself. Now, in this occasion, I want the long end to go this way and the short end to come this way. So I'm going to wrap it around the forceps first, like this. So my hands don't cross. 1, 2. So you're using the instruments interchangeably. Make sure you pick the right one up. Tips down, wrap it round. And then pass it to the other instrument, wrap it round. So my hands never cross. That's what you call economy of movement. And as you can see, hopefully it looks like it's getting easier, and it should be getting easier because I'm getting better visual field access. It's just important to practice these things as often as possible. And get a bit quicker. So I'm working my way from the back to the front. Just want that suture thread. Give myself some counter traction. And I need to go down here. Because it's on my side, it's a bit easier. Always see the tip of the needle before you go across. I've let go of it, but I know where it is. Park it somewhere I can see it. And tie. I'm going to put the tips up. Bringing the short end towards me. Alternate, wrap it around the needle holder. Wrap it around the needle holder. Like I said, when I'm cutting both, I cut the needle end last so that I know where it is at all times. And so now my last few stitches get easier because they're on the anterior surface, but I'm going to zoom out so you can see my hands a bit better. So we're going to go in the lumen, if we can get inside. Keeping counter traction. And follow through. You have to decide at this point if you need to put another suture in. For educational purposes, let's say we do, sew. you just do a continuous suture. See the tip? And then you have a choice. You can either cut your suture or tie it to the loop. I personally prefer to cut my suture and tie them individually, but you don't have to. You can tie it as a loop. It's just remembering who you're tying to who. So I'm tying this one. In an ideal world, I'd have left it a bit longer, but that's okay. Let's struggle a little bit. Let's go. Tips up. I'm being a bit flexible with how I hold things. 1, 2. And 1. And 1. I'm going to cut these short. And then we have to tie our knot end. That's the first suture we placed. 1, 2. And then I pass the instrument to this end. 1. Wasn't the right one, it was this one. And then this one. One more for good measure. Turn the tips down so it's easier to grab. And so the key is I'm using the instruments interchangeably. So I pass it into my other hand, I wrap it around here. I pass it into the other hand, I wrap it around here, so that my hands never cross. Okay? I'm going to cut the short suture first, and then the long, so that I have the needle ready to park. If you lose one of these, you'll never find it again. So then you check everything to make sure you're happy, front and back, sides, and then let your clamp off. Let the clamp off distal first, then proximal. I think your limbs are higher flow from proximal. So if I've got a digital vessel, clamp is here and here, release this one first so you get the backflow and the lower pressure. And if you see there's a leak, you can place the suture on without putting the clamp back on, and then you can, once that's closed, let off the proximal flow. So, medsingltd.com/resources covers these members only lives and more textbooks, plastic surgery specific videos coming as of probably this weekend, one-to-one sessions, live events, so much more. Same cost. See you next week for another members only live.